Good. So Brazilian butt lift, it's basically a surgery which involves removal of fat tissue from areas of the body where the fat is not desired, such as the stomach or the flanks, the waist area. And then we take this fat and transfer it into the hips and the buttocks to get more rounder hips, fuller buttocks, give more like a natural hourglass figure. Yes, because what we are doing here is moving the patient's fat tissue. So the results are permanent. Initially, at the beginning, there'll be swelling. Usually we tend to transfer more fat that we needed because a lot of the fat which we transfer will break down and will get absorbed. By 3 to 6 months, the final shape, what we end up is a permanent results for life. This is a good question, actually. Many patients ask for it. So what will happen is if you lose weight, all the fat cells in the body shrink down. So what we're doing with the Brazilian butt lift is we're removing the fat cells that stores the fat from one area, such as the stomach, into the hips and the buttocks. So what these cells will do, if you lose weight, it shrinks down. If you put weight, it gets bigger. So it just reacts with your body weight changes. Yeah. So yeah, that's a really good question because Brazilian butt lift had this bad reputation of being a dangerous operation, which in reality it was. And the reason for it, in the past, surgeons used to inject the fat into the muscle, into the gluteal muscle of the buttock, and under the muscle to get more volume in and to help the fat survival. But anyway, so that was the routine practice. But what used to happen is that some of the fat would leak from the muscle, or it goes into the blood vessel, and it will travel to the lung, causing blockage or the fat embolism. So the risk of fat embolism when the fat used to be injected in the buttock can be as high as 1 in 2,000, which is very high. Now, with advancement, with more studies, we know now that the fat shouldn't be injected into the muscle because it's a risk of fat embolism, and it should be only transferred into the subcutaneous place, which is meaning between the muscle and the skin, in that layer of muscle and the skin. So here in the UK, everybody who wants to do Brazilian butt lift, they can only transfer the fat superficially under the skin. And what we call it now, we don't call it Brazilian butt lift, we call it superficial fat transfer or superficial gluteal lipofilling. And in order to make sure that the fat is only transferred under the skin over the muscle, surgeons need to use an ultrasound scan to improve the safety of the procedure. Good. So recovery from the Brazilian butt lift, it comes in stages. So usually for the first week or two, patients will be just resting, doing very minimal. It's good to walk around. Takes about a week to 2 weeks to go back to light activities, and about 3 weeks to go back to full physical activities. The main thing that patients shouldn't, I ask my patients not to do, is not to sit on the buttock and not to lie flat on their back or on the hips, and not to apply any pressure on the fat which is transferred, just to help the fat tissue to survive in the area. Usually after 3 weeks, patients can go back to their full physical activities.